In a groundbreaking experiment, I replaced a radiologist with AI for a month, and the results were astonishing. The AI correctly diagnosed 97% of the medical scans, outperforming the human radiologist in some areas. But what does this mean for the future of healthcare, and should we be concerned about job losses? As AI continues to advance in the medical field, the stakes are higher than ever. If we don't adapt to these changes, we risk being left behind in the healthcare revolution. The question is, what can we do to prepare for this shift and ensure that we're not replaced by machines? The impact of AI on healthcare goes beyond just diagnosis. It has the potential to revolutionize patient care, streamline clinical workflows, and improve health outcomes. But with great power comes great responsibility, and we must consider the ethics of relying on machines to make life-or-death decisions. To conduct this experiment, I partnered with a leading medical research institution and gained access to a large dataset of medical scans. The AI was trained on this data and then tested on a separate set of scans to evaluate its performance. One of the most surprising findings was the AI's ability to detect rare diseases that human radiologists often miss. In one case, the AI correctly diagnosed a patient with a rare form of cancer that had been misdiagnosed by two human radiologists. But how does the AI's performance compare to that of human radiologists? In a head-to-head comparison, the AI outperformed the human radiologists in terms of speed and accuracy, but there were some notable exceptions. Despite the promising results, there are still concerns about the limitations of AI in healthcare. For example, the AI struggled with scans that were of poor quality or had been taken using outdated equipment. To overcome these limitations, researchers are exploring new techniques such as data augmentation and transfer learning. These approaches have shown promising results in improving the AI's performance on low-quality scans. The implications of this experiment go beyond just healthcare. It has significant implications for the future of work and the role of humans in an increasingly automated world. But what about the human touch in healthcare? Can AI ever truly replace the empathy and compassion of a human doctor? The answer is complex, and it's an issue that requires careful consideration. As we move forward in this new era of healthcare, it's essential to consider the potential biases and risks associated with AI. For example, if the AI is trained on biased data, it may perpetuate existing healthcare disparities. But here's the twist. The AI's performance was not just about accuracy. It was also about the way it changed the workflow of the radiologists. The AI enabled them to focus on more complex cases and improved their overall productivity. As I dug deeper, I realized that the AI was not just a tool. It was a catalyst for change. It forced us to rethink the way we approach healthcare and to consider new ways of working that combine the strengths of humans and machines. But what about the darker side of AI in healthcare? What about the potential for AI to be used for malicious purposes, such as creating fake medical scans or manipulating patient data? To mitigate these risks, it's essential to develop robust security measures and to ensure that AI systems are transparent and explainable. This is a complex challenge that requires collaboration between technologists, policymakers, and healthcare professionals. So, what can we do to prepare for the future of healthcare? First, we need to invest in education and training programs that help healthcare professionals develop the skills they need to work with AI. Second, we need to develop and implement policies that promote the responsible development and use of AI in healthcare. This includes ensuring that AI systems are transparent, explainable, and fair. Finally, we need to recognize that the future of healthcare is not just about technology, it's about people. It's about creating a healthcare system that is compassionate, equitable, and just for all. As we move forward in this new era of healthcare, we must be aware of the potential pitfalls and challenges. But we must also be open to the possibilities and opportunities that AI presents. The future of healthcare is uncertain, but one thing is clear: AI will play a significant role in shaping it. The question is, will we be able to harness its power to create a better, more equitable healthcare system for all?